So I have a client here today who had a tummy tuck a year and a half a year ago. And she's coming in for body contour today. So the reason why I wanted to showcase this is because I feel like a lot of you all who are in the aesthetic field, when you are doing body contour and you're using the cavitation machine or the RF machine, as you can see, her incision is fully healed. That means I can begin service. I can administer using the machine. I can use the wood therapy and so forth. But if she came in here and this was fresh and it was still secreting blood and mucus and stuff like that, you want to refrain from using the cavitation machine or the RF machine. You just want to do more of using your hands and just do more of lymphatic drainage first, and then when the scar tissue starts to heal, that's when you can determine if you should use the machine or not. Okay, all right, so stay tuned. So when you are working the abdominal, which is right here, the sides, you see how I'm just gently stroking and smoothing it out. I'm not doing more of this, because what you're doing is you're trying to warm up the skin, okay? Everything you do is like baby steps. So again, because she had the surgery a year ago, remember, she's probably still healing internally. Just the outside right here is just showing us that she's healed here. But internally, we have to train the body. So doing this hand technique is allowing me to communicate with my client, right? How do you feel?
Good.
I'm warming it up. You see, you don't want to go in so aggressively, because when you start, then you're shaking her and you're like, what the heck is going on? And then now you're messing up her nerves, right? Do you agree?
Yes.
Absolutely. So she's doing gentle strokes like this and going down. The more you're going down into the vagina area, you're actually helping the blood flow, lymphatic drainage, okay? You're boosting like pretty much everything in the body, the waist, the adipose tissues, the fascia. You're getting everything ready, right? So this is always the first step. So once you're using your hands and then you move into here. So you're flushing it down, right? You're not moving this way. You're not moving that way. You just want to focus and keep that silhouette. Because of course, I'm sure she wants the curvature, right? So we want to keep going like that. So for me, I'm going to keep sculpting here and pushing the rib cage in every time she comes in here. So I'm training the body, I'm training it, and then when I come, I go like this, and then I press, and then right here, this pelvic bone, you press 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Tell your client to take a deep breath, please. And then you release. And you go like that. How do you feel?
Feels good.
See? So, you also want to make sure that the client is well relaxed. She's at ease. And you want to always do this for every session. Every session. Always keep that momentum going. Okay? Then once you're done warming the tummy up and the sides, see my thumb? The thumb. Just press here, and then this side here from the back, bring it, belly button, and go down. Right there. This is always where you want to stop. Okay? Alright. One of my favorites. You're actually going like this. Looks like you're baking a cake, or you're pressing on fire, but this is a human being. So what we're gonna do, you see how my hand is moving like this versus like this? You do not want this technique. You want this type of technique. Why? Because it's light. Tell me if you feel a difference when I do this with my hands changing. Does it feel aggressive or the same?
Same.
What about when I do this?
Feels more aggressive.
This way?
Yes.
It's more aggressive?
Yes.
Versus like this?
Yes.
Well, this is the wrong way. This is the right way. Because you want it to feel like a fan. And it's focusing on the area that is loose. So for the client, she's saying that this feels a little bit aggressive, but it's actually light for me. But if I do this, this is more aggressive. You see? Because I feel like I'm pressing. And you don't want to press. You just want to gently smooth. You see? Kind of like I'm doing like this. Versus doing like this. So when I do this, you never want to do that. You always want to keep that hand light like that. So, you know, it's always good to listen to clients, but respectfully, based on the way I was taught, your hands has to always go like this. All the time. And you want to keep rolling, and you try to count like 30 seconds, 10 seconds, 20. How do you feel? And then we're going to do the sides a little bit. Keep that same hand gesture. Same thing here. And this is also waking up the stomach. And you can always go back and drain. Go back and drain. Go back, waist, turn your hands up, and then boom. And then come over here, take your thumb, belly button, pass through the belly button, and then come down to the pelvic bone right here, right there, and then press. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 18, 19, 20. And you're gonna feel the tightness of someone who had surgery. Always be careful, you know, and then work down like this. All right, and always cover them up when you finish. And we're gonna move to the next step, the RF for the body. All right, we have one for the face, but right now we're doing the body, like the arms, the stomach, and the legs, and the back, and the booty, if you want to. So her problem area is the back right here. So I timed it to 3 minutes. So we're gonna keep working until we're done. You're gonna see how, are you feeling any like heat or anything like that? Good. And that red light therapy is always a good thing because you're promoting good blood flow. You're boosting the collagen fibers, the fascia, and then again, you're also reducing the adipose tissues and the arm fat. So the more sessions she does come to me, you'll start to see she'll start to see a difference. So what I like to do, I like to keep a before and after journal, and that lets me know what I'm doing and what to expect, and just pretty much letting me know that, okay, my service is working for her. And then after this, she's gonna refrain from eating a lot of bananas because water retention, we don't want that. We wanna remove that water retention away. So we're gonna keep working. 1 minute left. And we'll be back. My professional estheticians, we are back. I'm gonna be using the RF to show you how I use it when you have a client that had C-section in the past. My client, she had a tummy tuck a year and a half ago. So I'm gonna show you how I use this on her tummy. Right here, she's still healing inside, but if you look at her incision, she fully healed, okay? But internally, she's still healing. Right here, she did tell me that the sensation here is fine, but this area here feels a little bit tight, right?
Yes.
So we're just gonna keep working, healing, sculpting, and making sure that she's fully contoured, okay? So I'm gonna start my machine now. It's gonna change color. You always wanna make sure you have a LED light. This is actually great to boost the collagen. It's also good for blood flow and to tighten up the skin area. Right now she's gonna feel some heat, which is also a good thing because it's going into the third layer of the skin. And be very gentle, okay? And then what you can do, you can glide it as if you're using your hands, excuse me. Just keep going like this. So right now, it's like I'm focusing on this side. Okay, 5 minutes on this side. And then it's gonna make a beep sound, and that's when you work on this side. All right, how do you feel?
Feels good.
Always communicate with your client, always. And you see like my technique, you see everything goes down again to the pelvic bone area because we're also draining, okay? And then you could do little circles right here, just little circles, very gently. You can go along the incision here to heal the scar tissues. I'm telling you, this is also beneficial for her. The light, it's healing. It's a healing light. You just keep going like this. How do you feel?
Feels good.
Good. All right. Right now we have 3 minutes left. Gently stroke all the way down. Be careful with the rib cage area right here. Go down. All right. Just little circles and then go. Okay. All right, so stay tuned. We're gonna do the other side now, all right? She is getting a butt lift, but she wants more hips on the sides. So this machine is going to help her. It's gonna bring out more hips for some strange reason. That's what the machine does. Okay, it's like a vacuum, so it's really plumping up the area, making it more firm and juicy, and giving it what it needs. So you're customizing right now. And always put a towel here, okay, if you're gonna like promote and post this on social media, so that way Instagram doesn't like tell you to put it down. But look at that. So we're gonna keep this on for about 5 to 8 minutes. And how is the pressure, my dear?
Feels good.
See, it's relaxing. She enjoyed her session. This is her first time with me. Again, she had surgery a year and a half ago. She had a tummy tuck. Her body is amazing.